How much height or length can be safely gained as we go to the grey area also, or the first two areas?
Yeah, if it's just a unilateral, that is only one side is shorter, then 8 to 10 centimeters in a couple of stages is not a big problem. Sometimes we have very difficult problems, what is known as congenital. In congenital, what happens is the body is programmed in such a way. For example, if you had injury, okay. Now this child was born with kind of programming that the leg is going to be so long. So the muscles are built for that length. Unfortunately, it got injured, so the leg was shorter. But now if you bring it back to normal length, the muscles don't resist. In congenital conditions, what happens? They are born with a kind of programming that this bone will be this short, these muscles will also be this short. So in those cases, when you try to lengthen, the muscles resist very badly and they can have all kinds of complications. So we say congenital lengthenings are the most difficult. The other side of the spectrum is cosmetic lengthening. Again, this is a normal person with a full range of movement. Let's say the knee, for example, moves from straight 120 degrees of flexion. The ankle moves from 15-20 degrees of dorsiflexion to another 30 degrees of plantar flexion. Now this guy, when you are lengthening him, if you reduce any of his movement, he has gone from being a short normal to a longer abnormal because he's lost his muscle. If you have to squat down, for example, you require that dorsiflexion. So what I tell them when people who come with for cosmetic lengthening is that if you do your exercises well, you will keep your range of motion. But if you stop, or rather you start losing your range of motion, then we stop lengthening. You work double hard at the physio. And if you come up again, then yes, we can lengthen. Now, having said that, up to about 5 centimeters of lengthening in the tibia, this is for cosmetic, okay, doesn't have a problem. Okay. At 5 centimeters, most patients start having trouble. If they work properly, up to 6 centimeters, we don't have any real issue. 6 to 7 is the time that you can start having long-term problems. Like, say, they call it ballerina foot. So this starts happening by around 6 centimeters, even for the most, motivated
active
patient. Yeah. So they have to work really hard at it. In the femur, about 7.5 centimeters is good without any trouble.